Thank you for joining us for this Clackamas County Emergency Operations Center update. There's a lot happening in the county in our response to COVID-19. The vaccine is here and we're hosting vaccination clinics starting this week for eligible residents. However, we're still seeing our positive COVID-19 cases go up. And if they go up much more, we will be forced to go back into a high-risk category. At today's Board of County Commissioners business meeting, our Public Health Director, Philip Mason Joyner, provided an update to the board on our vaccine supply, as well as explaining why our cases are going up. Let's listen in.
We highlighted this in red because it's important, 98.7. So we are still for another 2 weeks starting tomorrow at moderate risk for reopening metrics for businesses. That's good. However, you can see the trend is heading in the wrong direction. And we are concerned that 2 weeks from now, we don't want to be a situation where we're moving backwards. If that does happen 2 weeks from now, where we're sharing this data and this number is above 100, then the state of Oregon has a new process where they'll let us know that we are in a caution state. And we have 2 additional weeks before then we would move into the high risk category. What that means is for the majority of our businesses, instead of being at 50% capacity, which they are right now, it would reduce them back to 25%. That's something certainly we do not want to have happen. With spring break, with schools reopening, we really need, the community and all of us through our individual actions to continue to follow those tried and true public health precautions, wearing masks, keeping distance, practicing good hygiene. And if you are feeling unwell, that you are staying home and staying away from others to protect them from potentially spreading COVID-19. The majority of my info, of course, lately is around the vaccination effort. So over 90,000 people at this point in Clackamas County have received vaccinations. Either they're fully vaccinated or they're in process. We have lots of appointments at clinics as more vaccine supplies are coming in, where a lot more folks are scheduled in the coming weeks to get vaccination. And at this point, this represents 21.5% of our county's population. Last week, as folks have likely seen in the news, that the timelines have been brought forward. So that's good news that more people are going to be eligible to be able to get appointments than originally anticipated. Starting on Monday, this upcoming Monday, March 29th, those who are age 45 to 64 that have underlying health conditions will be eligible to get the vaccination. So this blue line here shows you what the anticipated first doses are that's coming into the state. And the gray line shows where we are at around eligibility. So group 6 in the middle of the screen there, that's Monday. So you can see again, supplies and demand. There is more demand, and that's the way the system has been designed. So here are the appointments. We have actually at the town center tomorrow, we still have appointments on Friday and Saturday. You can go to clackamas.us right there on the main page. It provides you with the link to access the appointments. We also have appointments at Malala High School next Wednesday. So really want to encourage folks, hop onto our website to get access to the appointment. It's really important that you follow the instructions. There is a code that you have to enter. And so there, we've heard from some folks that have had some technical difficulties with that. But once you enter that code, you should be able to access and select the time to get the appointment and the additional instructions that you need. They are appointment only. You do have to schedule an appointment in order to receive a vaccine.
So what can you tell us about the type? Are these outbreaks? Are they work-related, home-related? What can you tell us? I thought our contact tracing would give us the ability to keep that under control. It looks like our neighboring counties, like Washington County, for example, seems to have some pretty good numbers lately. So what's going on in Clackamas County that we're kind of trending the wrong way?
It's a variety of different types of outbreaks, so connected to social gatherings also, so that's why spring break is a little bit of a concern right now. The timing is not ideal. Also, as I'll say, we have had a couple of significant exposures within local school communities. And to clarify, it's not been the school in-person instructions. It's actually interactions of people outside in the school community, connected to sports, connected to other activities. And so we have had some significant exposures, outbreaks, and issues related to that in a couple of the local schools. Also, a handful of workplaces, but that's been sort of commonplace throughout the course of the pandemic.
We cannot control how the state responds to our cases going up and possibly returning to high risk. However, we can control and slow the spread of the disease by continuing to practice safe behaviors. Please continue doing what you can by maintaining your physical distance, wearing your face covering, washing your hands, and avoiding groups to protect yourself, your family, and the community from COVID-19. As of Thursday, we still have appointments available for our vaccination clinics. Please visit our website to sign up for an appointment if you're eligible to receive the vaccine. If you or you know somebody who doesn't have access to a computer, you could give us a call and we'll help you set up your appointment. Thank you for joining us this week. Please stay safe and we'll see you soon.